Hello, my name is Dr. Teresa Wagner. I'm an associate professor at the University of North Texas Health Science Center School of Public Health. I'm also the interim director and clinical executive for health literacy with SaferCare Texas. SaferCare Texas is a department housed within the HSC that focuses on patient safety. We work to eliminate preventable harm by providing education and training to the community on various health topics. Today you will learn about opioids, the opioid crisis, fentanyl, and signs of an opioid overdose. You will also learn about Narcan as an opioid overdose reversal tool, including how to properly administer Narcan to potentially save lives. Let's start by first discussing the opioid crisis in the United States.
The CDC outlines the rise in opioid overdose deaths in 3 distinct waves. The first wave began with increased prescribing of opioids in the 1990s. The second wave began in 2010 with rapid increases in overdose deaths involving heroin. The third wave began in 2013 with significant increases in overdose deaths involving synthetic opioids, particularly those involving illicitly manufactured fentanyl. According to the Center for Disease Control and Prevention, over 75% of the nearly 107,000 drug overdose deaths in 2021 involved an opioid. You may be wondering, what is fentanyl and why is it so dangerous? Fentanyl is a powerful synthetic opioid that is up to 50 times stronger than heroin and 100 times stronger than morphine. Just 2 milligrams of fentanyl, equal to 10 to 15 grains of table salt, is considered a lethal dose. Illegally manufactured fentanyl is found in heroin, cocaine, methamphetamine, and counterfeit pills. As a result, many people may not know they're ingesting the fentanyl, leading to accidental poisoning. The increase in opioid deaths can not only be attributed to the increase in illegally manufactured fentanyl, but a lack of health literacy. According to the National Institute of Drug Abuse, 25% of people prescribed opioids misuse them due to a lack of understanding. Additionally, up to 80% of people who use heroin first misuse prescription opioids. According to Texas Health and Human Services, 39% of opioid overdose deaths occurred from prescription opioids in 2021.
Opioid overdose can look different for every person, but here are some common signs. They may have small, constricted, pinpoint pupils. Their face is extremely pale and feels cold or clammy to the touch. Their body may go limp. Their fingernails or lips may have a purple or blue color. They may start vomiting or making gurgling noises. The person cannot be awakened or may be unable to speak, and their breathing or heartbeat may slow or stop. Naloxone, also known as Narcan, is a medication that can reverse an overdose from opioids, including fentanyl. Keeping it on hand is important not only for those with a history of drug use, but for people who are prescribed opioids. Narcan is harmless to people who do not have opioids in their system and are not allergic to naloxone. This means that even if you are not sure the person is experiencing an overdose, you should still administer Narcan. The FDA also recently approved Narcan to be sold over the counter without a prescription, which allows non-medical staff to be able to administer this potentially life-saving medication.
Now we are going to learn how to administer naloxone. In this demonstration, we will be administering the over-the-counter reversal agent, Narcan. First, check for responsiveness. Next, call 911. Stay on the line for further instructions from the dispatcher and let them know how many doses of naloxone you have on hand. Roll the person onto their back. Open your package of naloxone. Tilt the head up by lifting the chin. Insert the plunger fully into one nostril and depress the plunger. Do not prime or test the device prior to administration. Move the person to their left-hand side, which is the recovery position, after giving naloxone. Wait 2 to 3 minutes while monitoring the person closely. Additional doses may need to be given every 2 to 3 minutes until the person responds or emergency medical assistance arrives. Different brands of naloxone have different half-lives. Usually, naloxone can take 15 to 30 minutes to reach its most effective state and can last between 30 to 90 minutes inside the body depending on the person's age and the brand of naloxone. If the ambulance has not arrived and the victim begins to have difficulty breathing, administer an additional dose of naloxone. If at any time the person does not have a pulse, begin CPR. Depending on the situation, hands-only CPR may be most appropriate. Ensure your personal safety at all times.
In response to Governor Greg Abbott's One Pill Kills campaign, SaferCare Texas is executing our mission of eliminating preventable harm by offering Narcan life-saving training at the University of North Texas Health Science Center at Fort Worth. Through education and training, we can bring awareness to the opioid epidemic and teach life-saving skills that can prevent opioid overdoses and deaths. For help and resources, please call the National Helpline at 1-800-662-4357 or visit findtreatment.org. To sign up for our upcoming Narcan training, please visit our SaferCare Texas website at safercaretexas.org.